So in this video, I want to talk about pink puffers and blue bloaters. Okay, so pink puffers are patients who have emphysema, and blue bloaters are patients who have chronic bronchitis. Okay, in this video, I have tried to explain these two concepts separately, but it is very likely that a patient may have both of these conditions. Okay, because both of these conditions is caused because of smoking. Okay, so COPD has got two components: chronic bronchitis and emphysema. Okay, so basically what happens is that when smoke irritates area in and around the alveoli, it leads to the destruction of fibers that are present in and around the alveoli. Okay, so the structural integrity of the alveoli is compromised in emphysema. Okay, so this is a chronic condition where a stable baseline is maintained. Okay, in comparison to chronic bronchitis, emphysema is a more stable condition. Okay, chronic bronchitis is also chronic, but it is episodic. So what do I mean by this? So basically what happens in chronic bronchitis is that first of all, I want you to understand the normal physiology. Okay, it is through the mucus that we are able to expel out bacteria, viruses, dust, dirt, and other things. Okay, so whenever there is any kind of irritation because of some offending agent, the body will produce mucus. Okay, but if the irritation is too much, then the body will produce too much mucus, and because the mucus is too much, the body will not be able to expel it out. Okay, so in Islam it is said that when water is flowing, it is pure, and when it is stagnant, it is impure. So similarly, when mucus is not being expelled out, it is stagnant. Okay, so bacteria, viruses, dust, dirt, and all these things will not be able to move out. So because of this, the mucus will act as a nidus for infections. Okay, normally we have infection for some time, and then the immune system is able to clear it. Okay, so we have episodes of COVID or of flu. Okay, and for rest of the year we are generally stable. Okay, so in chronic bronchitis we have episodes. Okay, episodes where we have infection. Okay, so the mucus, it will act as a substance that will obstruct the flow of air, but it will also act as a nidus for infections. And whenever we have an episode of infection, we have an acute exacerbation or an episode where the problem is becoming much worse in chronic bronchitis. So chronic bronchitis is an episodic condition. There are episodes. It is an unstable condition. On the other hand, comparatively, emphysema is a lot more stable condition. Now, because emphysema is a stable condition, the body is able to adapt. We are able to breathe in deeply, breathe out deeply. We are able to increase the frequency of breathing. We are breathing out through pursed lips. We are breathing out in the form of small puffs. Okay, okay, so pursed lips is like this, something like this. And but because chronic bronchitis is an unstable condition, we are not able to adapt. So what happens is that because we are not able to adapt, the chances of having cyanosis is very high in chronic bronchitis. Okay, so because there is cyanosis, the person will look blue. So this explains the blue component of blue bloaters that is seen in chronic bronchitis. Okay, so the good thing is that if you remember just one component, you will be able to remember the other component, because this is an alliteration: B for blue, B for bloaters, P for puffers, P for pink. Okay, so now we have understood the blue component of blue bloaters. Okay, now because cyanosis is not present in emphysema, so the person will not look blue, the person will look pink. Okay, because the body will adapt. Maybe it will secrete a lot of hemoglobin, and then the person will look very pink. Okay, so this explains the pink component of pink puffers that is seen in emphysema. Now let us try to understand what is puffer. Okay, so basically, in emphysema, there is compromise of the structural integrity of alveoli. So there is a very high chance that while breathing out, when the pressure falls, the alveoli can collapse. Okay, so especially if we breathe out too rapidly, then the chances of alveoli collapsing is increased. Okay, because according to Bernoulli's principle, pressure is inversely proportional, not exactly inversely proportional, but if the velocity is very high, then the pressure will fall. Okay, so if we breathe out too rapidly, then there is a chance that the alveoli may collapse. So what we do is that instead of breathing with a wide open mouth, we instead of breathing out through a wide open mouth, we breathe out through pursed lips. So our lips are like this. Okay, and instead of rapidly breathing out, we breathe out in the form of small puffs. Okay, just like a smoker, he takes in small puffs of smoke. So similarly, a patient of emphysema will try to breathe out in the form of small puffs. Okay, this is the reason why the patients of emphysema are called puffers. So we have understood why the patients of emphysema are called pink puffers. Okay, another thing is that now I want you to understand why the patients. So because in emphysema, I said that the patient is pink because there is too much hemoglobin. Now, because the hemoglobin is high, then the metabolism will also increase, and when metabolism will increase, the person will become thin. On the other hand, the patient of chronic bronchitis, he will look fat. Why this is so? Because see, what happens is that whenever there is reduced ventilation to a region of a lung, then there is vasoconstriction. This is done to prevent ventilation perfusion mismatch. Okay, so ventilation perfusion mismatch is a concept. Okay, anyway, the point is that what happens in fetal life when the fetus is inside the uterus, blood does not flow from the right heart into the lungs because the lungs, they are not getting ventilated, so the vessels are getting constricted, and that is why the right heart is not able to pump blood into the lungs. Okay, similarly, in patients of COPD, due to large scale vasoconstriction, there is right heart failure. Okay, so basically what happens is that in emphysema, the heart will in some sense adapt because the heart can hypertrophy. Okay, even if there is not the respiratory system has in some way failed, but it can adapt. We will breathe rapidly, will breathe deeply, but all these adaptations are not happening in chronic bronchitis. Okay, so in chronic bronchitis, because of reduced ventilation into the lungs, there will be vasoconstriction and the right heart will fail. Okay, and when the right heart will fail, there will be edema in the body, because when the blood is not moving forward from the right ventricle, then the blood will move backwards and then it will accumulate in the veins, and then the hydrostatic pressure in the veins will increase. This will increase the hydrostatic pressure in the capillaries, and then there will be edema, and because of edema, the person will look fat. So basically what happens is that oftentimes a lot of people have got fat in the abdominal region. Okay, but some people, they don't have fat in the abdominal region, but it seems that they have fat in the abdominal region because of indigestion. So we say that these patients are having bloating. Okay, so bloating is when a person looks fat. Okay, so in chronic bronchitis, if the person looks fat due to fluid accumulation, we'll say that the person is a bloater. Okay, so this explains why in chronic bronchitis the patients are called bloaters. So we have understood why they are called blue. So the patients of chronic bronchitis are called blue bloaters. Okay, now one more thing I want you to understand, and that is that in type 1 respiratory, there is a mnemonic. Okay, so the mnemonic says that in type 1 respiratory failure, the levels of the level of one gas is deranged, and in type 2 respiratory failure the level of two gases is deranged. Okay, so basically what happens is that now see, type 2 respiratory failure is very intuitive, because I mean, why will the respiratory system discriminate between gases? Okay, if it has failed, then the levels of both the gases, carbon dioxide and oxygen, will get deranged. So type 2 respiratory failure is very intuitive. Type 1 respiratory failure is somewhat less intuitive. This is because CO2 is more soluble in water, okay, because it has got uh, polar regions, okay, because it is made up of dissimilar atoms, and that is why it is soluble in water, because water is also water is also polar. So CO2 is polar and water is also polar, so CO2 is soluble in water, because like dissolves like. So that is why, because of the solubility of CO2, we have a lot of carbonated drinks like Mirinda, Pepsi, Thumbs Up and all that, but we do not have so many oxygenated drinks. Okay, even though the amount of oxygen in the environment is higher than the amount of carbon dioxide that is present in the environment. So because CO2 is more soluble in water, that is why it is easy to move in and move out CO2. Okay, all right, move out, sorry, not move in so much, move out CO2. Okay, right. uh, okay, so so that is why in type 1 respiratory failure the level of oxygen get decreased, but the level of CO2 does not increase. Okay, so this explains why the respiratory system discriminates between oxygen and carbon dioxide. So I told you that in emphysema the person can adapt, okay, but in chronic bronchitis the person cannot adapt. So, in chronic bronchitis, the levels of both the gases will be deranged, and in emphysema, the levels of only one gas will get deranged. Okay. And in the latest, so in the initial stages, in emphysema, the level of only one gas will deranged. In the later stages, the levels of both the gases will get deranged. So, in the initial stages, emphysema will present with type 1 respiratory failure, and chronic bronchitis will present with type 2 respiratory failure. In later stages, both will present with type 2 respiratory failure. Okay, so yeah, these are some of the points that I wanted to make. Okay, so I have told you that a patient can have both. I have explained why a person is called puffer, why a person is called pink, why a person is called a bloater, why a person is called blue. I have explained about type 1 and type 2 respiratory failures. I have also explained about uh, that metabolism will be high in emphysema because there is a lot of hemoglobin as a means of compensation. That is why the person will become very thin because of high metabolism. Also, because you are adapting and you are breathing in more rapidly and more deeply, you are spending more energy, so that will also contribute to the person looking thin. Okay, so these are some of the things that I wanted to convey through this video. Hope you liked the video. Thanks for watching.